Daniel Whitehead is the CEO of Sanctuary Mental Health Ministries, a resource to help equip the church navigate faith and mental well-being. Thank you so much for joining us today, Daniel.
Oh, thank you for having me. It's great to be with you.
So the conversation around mental health is so important. What does a church approach to this discussion look like?
Yeah, well, I think Sanctuary exists to help the church navigate the mental health conversation. Many churches simply don't know where to start, and I think that Sanctuary, we would say, where we start is to integrate some different ideas. So to take our faith, a clinical approach, and to keep a person with their lived experience central. And if we can have a conversation that's cognizant of these three different ways of holding this subject, the church will be doing really well in becoming a safe place and a place that people feel free to open up and share their challenges with each other.
So what does that look like? How do you interact with the church in order to encourage that? How do you walk alongside churches?
Yeah, so we create resources, a number of resources, but our main resource is the Sanctuary course. And really, the vision for the Sanctuary course is an 8-week discussion, film-based resource that churches anywhere can pick up and use. And we've had downloads in over 55 countries. So anyone anywhere can download it, and it will help facilitate a discussion which is really influenced and informed by these three different perspectives: the clinical, the theological, and the lived experience. So it really helps churches to begin to build a framework and build a shared language and vision for this ministry.
Now, with illnesses like depression, people often retreat. How can a church make sure no one slips through the cracks and mental health is not seen as just a side ministry, but an important part of God's ministry?
Yeah, I think that's a great question. There are a number of ways churches can do that, but the primary one I would probably suggest is to ensure that the subject is being spoken about in a very open and public way,
Mm.
so that there's no shame for people. People in the midst of crisis know that this is a safe place for me to share what I'm going through, and then people can check in. And it can feel like a scary, awkward conversation for churches that feel ill prepared. But I tell you, a listening ear, a kind face, a word of encouragement goes a long way when someone is in the midst of crisis.
Yeah. The pandemic was hard on churches, and it was hard on people who relied on Sundays for those gatherings of people, just seeing other people. What have you seen when it comes to pastors and ministries putting a focus on mental health?
Mm. I think a lot of churches are now attuned to this idea that mental health is a really important subject.
Yeah.
My fear is that it doesn't become a fad subject, that it isn't something that in 20 years' time we say, oh, remember when we used to talk about mental health? I think a fundamental change is needed in the church. I mean, I was a pastor for 10 years and I really struggled in my mental health, but I had no way of talking about it, no way of knowing that. And so, what I'm seeing anecdotally are a lot of people struggling, including and especially pastors and leaders. This is an incredibly stressful time for them to know how to navigate a topic that keeps moving and changing. And so, I really think churches are doing the best they can, and we've seen a huge upscale in people finding our website
Mm.
and searching for help. So, Sanctuary's work has literally times 10 overnight when the pandemic hit. So I think people are looking for answers,
Yeah.
and we think we have some resources to help.
There's a cry out for help. What's a big misconception you think, Daniel, that churches have about mental health?
Yeah, I think very often, whether implicitly or explicitly, churches can have this attitude that says, and it's not a criticism, I think people mean well, but an attitude that says, well, that's something doctors deal with. And what do I know about that? And to a degree, yes, we absolutely need doctors and we need people to get clinical help. But that doesn't absolve the church from their responsibility to be good friends to people in the midst of crisis. And to actually have spiritual friendship alongside clinical care is vital. I would suggest spiritual friendship is just as important as the role of doctors, and the role of doctors is incredibly important. So actually, the church should see itself trying to work alongside clinical care. And sometimes churches can feel like they're at odds, like, oh, we don't touch that, that's medical, we just deal with the rest. But actually, in mental health, they're all enmeshed. They kind of come together. So we need the church to work with clinicians to offer support and care.